it's Dr. Karen with this week's hot topic. Make sure you follow us on social media, like this video, and subscribe to our YouTube channel so you never miss another hot topic. So today I want to talk to you about UTIs or urinary tract infections. Now, most of us have heard of what these things are, but if you don't know, they are infections affecting the bladder, kidneys, or connecting tubes, often causing burning pain when you urinate. Now, anybody can get a urinary tract infection, but they are more common in women and in the elderly population due to lack of bladder emptying. So what causes a UTI? Now, urinary tract infections are caused by microorganisms, usually bacteria, that enter the urethra and bladder, causing inflammation and infection. Though the UTI or most commonly happens in the urethra and the bladder, the bacteria can also travel up to the ureters and infect your kidneys. Now, more than 90% of bladder infections or cystitis are caused by this E. coli, which is a bacteria normally found in your intestines. So what are these symptoms of a urinary tract infection, just so you are aware of it? UTI infection causes the lining of the urinary tract to become red and irritated or inflamed, which may produce some of the following symptoms. So pain in your side or your flank, abdomen or pelvic area, pressure in your lower pelvis, the frequent need to urinate, so frequency is kind of a thing, urgent need to urinate, the urgencies, and incontinence for the urine leakage, painful urination and blood in your urine, so the need to urinate at night, abnormal urine color, so cloudy urine or strong or foul smelling urine, and other symptoms not necessarily common but can be associated to a UTI infection, pain during sex, fatigue, fever, so temperature above 100 degrees, with the chills, vomiting, and mental changes or confusion. So this one's super big, especially if you're caring for an elderly individual and then all of a sudden they have forgetful, they're confused, they might actually have a UTI. So how are UTIs diagnosed? So typically you have a couple tests to diagnose the type of UTI that you have. So the first thing your doctor might do is a urinalysis. So this examines the urine for red blood cells, white blood cells, and bacteria. So the number of white and red blood cells found in your urine can actually indicate an infection. Next, they might do a urine culture. So this is used to determine the type of bacteria in your urine. So this is super important because it helps determine the appropriate treatment plan you might follow. So how are they treated? Now, antibiotics are typically how they treat them because you want to stop the infection, kill the bacteria, and then fight against any future infection. So that's why doing a urine culture is super important, so you can figure out what kind of bacteria it is. Now, drinking plenty of fluids is super, super important, especially if you have a UTI and you watch your symptoms if you're just going to watch and wait. And you probably also heard about drinking unsweetened cranberry juice to flush out your system if you think you have a UTI. So really, fluids is kind of the big thing. Now, if you want to prevent a UTI, what do? So usually preventing a UTI happens with lifestyle changes. So some of these tips might include practicing good hygiene. So you can usually often prevent UTI by practicing good personal hygiene, so especially important for women because the urethra in women is much shorter than men, so it's easier for that E. coli to move from the rectum back into the body. So to avoid this, it is recommended that you always wipe from the front to back area after a bowel movement. Women also should use good hygiene practices during their menstrual cycle to avoid those infections, so changing pads, tampons frequently, as well as not using feminine deodorants can also help prevent a UTI. The other thing you can do is, like I've said before, is drinking plenty of fluids. So add extra fluids, especially water, to your daily routine. Can help remove that extra bacteria from your urinary tract infection because, another tip, it changes your urination habits. So urination plays a big role in getting rid of bacteria from your body. So your urine is a waste product, and each time you empty your bladder, you're removing that waste from your body. So urinating frequently can help reduce the risk of developing an infection, especially if you have a big history of frequent UTIs. So make sure you drink plenty of fluids. That does help encourage this, but make sure the fluids that you're drinking, avoid the ones that irritate your bladder. So these irritating fluids are like alcohol, citrus juices, caffeinated drinks, and spicy foods. And then the last thing you can do is change your clothing. So avoid tight-fitting clothing. Actually keeps you from preventing the bacteria and growing in the urinary tract because it keeps you dry. You can also switch to cotton underwear, so that'll prevent some extra moisture from getting trapped around your urethra. So hopefully you don't find yourself having UTIs frequently, but if you do, know that they are they're common, but they're super simple and easy to treat if you can catch them early, if you don't just kind of turn a blind eye to them. Again, especially in the elderly, they're super important because they can mimic